I want to pivot now to talk about the coronavirus pandemic, as the Delta variant has a new mutation. This is called Delta Plus, which sounds fairly worrying. We're joined now by Dr. Anand Swaminathan. He's an emergency medicine physician in New Jersey. So, doctor, always great to have you here with us. This Delta Plus mutation, how concerned should everyone or Americans really truly be about it?
We don't know enough about it yet to know how concerned we should be. At this point, what we know is that our vaccines are effective against the Delta variant. If you have 2 doses of one of the mRNA vaccinations, we know you're highly protected against Delta. What this tells us is that this variant is going to continue to mutate, which means that unchecked spread in the U.S. is going to lead to other problems. There's the immediate threat of Delta itself, and then there's the down the line threat of it mutating into something that may possibly be able to evade our vaccines. But at this point, we don't know enough to get too worried about vaccine evasion.
Doctor, do we know where this Delta Plus variant or mutation is popping up? Because I know the Delta variant seemed to have started in India.
I think we're seeing the first cases of Delta Plus being described out of India as well. I don't know that we've heard much about it elsewhere. And what we have to keep an eye on is what's happening in the UK. We found over and over again that what happens in the UK comes to the US. It's a little bit delayed. So we really need to keep an eye on what their sequencing is showing. And like I said, we just don't have enough of that data available yet to know really where this is going to spread or where it's going to be.
So then, doctor, I think this naturally just leads to questions and concerns around the vaccine hesitancy that we are seeing here in the United States. Some states more than others with much lower vaccination rates for the adults that reside there. How much of a concern should that vaccine hesitancy be, considering that we now have this Delta variant that is now going to become the predominant variant here in the United States, and now this mutation, Delta Plus, which seems to be cropping up and giving a little bit of concern and worry to some experts?
Well, it's a huge amount of concern that we have this huge vaccine difference between different states and within states between different counties. It's really on a micro level. So if you look at places like Missouri, there's a 40% increase in cases, and that's at a place that is very low overall vaccine rate. We're talking about 55% people with at least 1 shot in Missouri. Now you contrast that to somewhere like New York, where about 70% of people have at least 1 shot. And we are seeing 40% decline in cases. So it's a huge, stark difference. If people didn't believe that vaccines were really important, this is a microcosm of exactly that. Missouri, rising cases with low vax rates. And we knew this was going to happen. Where you have low vaccination rates and you forego public health measures, you're going to see surges. Within the state itself, we're going to see these micro surges because different counties have different levels. Like we mentioned before, you have some counties in Missouri that have as low as 20% with at least 1 shot in an arm. That is a huge problem because Delta or any other variant is going to spread like wildfire in those communities. And so we're really seeing this stark contrast. We're seeing a divide between those areas that are more vaccinated and are getting even closer to herd immunity, and those states and counties that are really lagging behind. And again, we have the short term, the Delta outbreaks, the Delta surges, which are already being seen in places like Missouri, where you have the rising cases, you have rising ICU bedding problems, rising hospital admissions. And then there's the delayed consequence. As the Delta variant spreads, it can create other variants.
Doctor, we see that there are a couple of groups most at risk right now. They are unvaccinated largely. We're talking about younger people and Black Americans. We know that Blacks have been disproportionately impacted by COVID-19. They make up 12.5% of the population, but accounted for 15% of the COVID-related deaths. What can governments around the country do to try and get those populations vaccinated?
So those two populations, it's interesting because the Black community has been a higher risk population throughout the pandemic, whereas young people are becoming a more high risk group. And for the young people, this really is a matter of vaccination rates. We see high vaccination rates among older Americans, low vaccination rates among the young. And this is tough because I think we all remember what it's like being young. You think you're invulnerable. And that's what we're seeing here. We're seeing a community that doesn't really think they're at risk. So we need to do better communication with those groups, get them to the vaccines. Now, for Black Americans, this has been a group that it really has had a struggle all the way through in terms of COVID rates. A lot of this hesitancy in that community is because they don't trust the medical community. And it's hard to blame them because there's been a lot of equity issues. There's a legacy of structural racism within hospitals and the medical system. But again, we need to do better communication, letting them know that these vaccines are safe and they are the best way to protect themselves and their community from COVID. So it's a matter of communication, increasing or improving access to make it easier, and remembering that both Black Americans and young people are typically frontline workers that are a little bit higher risk for COVID. And that's another reason to really fight hard to get them vaccinated.
All right, Dr. Anand Swaminathan, emergency medicine physician out of New Jersey. Thanks as always for joining us today.